APIN Public Health initiatives and the Ondo State government are expanding access to HIV and AIDS services. But this came with the launch of the Ondo State HIV Treatment Surge campaign. Ayodeji Muradeyo reports, and after this would have business news with Tolulokwe Ogunjobi.
This is the official launch of the Ondo State HIV Treatment Surge campaign. The program, which is funded by a collaboration of the Ondo State Ministry of Health, APIN Public Health Initiatives, Center for Disease Control, and President's Emergency Plan for AIDS Relief, attracted professionals in the health sector, government officials, the U.S. Consul General in Nigeria, and development partners. Ondo State is determined to ensure that adequate treatment is provided for people living with HIV.
HIV treatment.
Governor Rotimi Akeredolu, who was represented by the Secretary to the State Government, Oladuniodu, said the state has an HIV prevalence rate of 1.1%.
This is geared towards achieving HIV epidemic control that will chart a sustainable course for HIV prevention in Ondo State. Today's event is another first for our dear state in order to achieve the ambitious set target of 95 by year 2030.
The U.S. government is committed to assisting Nigeria and other countries in developing proven strategies for the treatment of HIV.
And equally important is our partnership with the federal government and state governments like Ondo State in supporting policy development, human capacity building, and strengthening of health systems, including the provision of state-of-the-art laboratories and pharmaceutical warehouses. Here in Ondo State, by the end of March 2021, there were over 12,000 people living with HIV/AIDS that were receiving PEPFAR-supported treatment.
Chief Executive Officer of APIN Public Health Initiatives said the initiative is targeted at identifying and placing 62 new HIV-positive claims on treatment every week.
We've broken the number that needs to be gotten in 2 weeks until when we need to reach that target. So if you must reach that target, you must get 62 a week. But we see here that at times we are 50, at times we are 40-something. So that's why they want us to just, surge is, like I was joking there, surge is just for us to increase our pace.
He expressed optimism that the program will go a long way in discovering and placing people on treatment for HIV.
Before now, we're waiting for them to come to the hospital. If you wait for them to come to the hospital, you won't get them. So there's increased community effort, which is why the civil society organizations will also be very helpful in making that to happen.
APIN is a leading Nigerian organization in the provision of prevention care and treatment services for people living with HIV and other diseases of public health significance. Ayodeji Muradeyo, TVC News, Akure.